Isolation and social distancing are taking a mental health toll on everyone, according to Stephanie Allred, Senior Clinical Director and Psychologist at Access Health System. Allred explains that with the constant changes and uncertain timeframes around social distancing, our nervous systems are having a hard time keeping up. Allred explains that anxiety, worry, and grief are normal reactions to what we are experiencing right now.
We can tolerate a lot when we know things are temporary, but for us, it is hard to not know when is the end going to be, or what will go back to what we used to call normal, or how long will things still be different for us.
Allred does point out that we should all be hypervigilant about any warning signs that signal a larger issue like depression or increased anxiety in ourselves or our loved ones.
But when we're not answering phone calls and not wanting to talk to people that we usually talk to regularly, that is a sign. When we have big changes in our sleep and appetite, those can be indicators. And also when we just don't have the usual interest or joy in the little things in life and the activities that we tend to gain some joy and interest in. Those are all signs that depression may be creeping in or may need a little attention. And a lot of people also just experience more anxiety. And again, anxiety is normal. It's a really important emotion for us to experience. It helps us in many ways. But when it starts becoming paralyzing or really impeding our ability to do things on a daily basis, that's when it might be helpful to reach out for a little extra support right now.
Allred's main message is that you are not alone and don't hesitate to reach out. Access Health System is open and available to respond to your needs.
There are services and resources available and accessible. Our integrated healthcare is open and available for medical concerns, as well as mental health and substance use concerns. So we have a crisis care hotline that's available 24/7. If you just need a little coaching or some tips or just some information.
During this time, we should also be aware that there are some populations who may be more vulnerable to depression and increased anxiety, such as teenagers and seniors. We know that teenagers have been experiencing more depression in recent years. According to a study by the Pew Research Center, 13% of teenagers between the ages of 12 and 17 have experienced at least one major depressive episode within a 12-month period. For seniors, feeling lonely is a key risk factor that can lead to depression. So what can we do to better support these vulnerable groups in our communities?
I have a couple teenagers myself. They've been troopers and are working hard on their schoolwork, but this is a really important time for them to have peer contact. And the good news is they're really good with technology, so they utilize their technology to stay connected. And again, I just know that they're missing their friends and those contacts. I also worry about the older adults in our community. I have a 93-year-old grandmother who's still living at home and stuck kind of on her own. So I'm very impressed with her that she uses email, but that's just not the same for her. She's used to having that close personal contact with people. And I think it's really starting to wear on her. So I really appreciate her neighbors knocking on her door and checking on her, keeping that good 6 feet of social distance, or maybe having a front porch conversation, interaction. So don't hesitate to reach out to our community members who, again, may not have as much access to technology and just need a face-to-face contact.
Thanks for watching this edition of Pagosa Local News. If you would like to see this story again, visit our website at pagosalocal.news, where you can sign up to have us deliver the news directly to your inbox.